Okay. So posterior mobilization, I'm going to take these pillows out, okay? What I like to do, because I'm relatively small, okay, is I usually come in and I have the patient, as long as they're comfortable doing this, what I'll do is bring the hip here, okay, and I'm going to mobilize posteriorly. So this is a posterior glide of the hip, okay? So I'm going to come in, I'm resting them here, okay? If they can't get way up here, that's fine. I can be here, but I'm going to lower my body down in, and I'm going to come in, I'm going to join my fingers together, and I'm going to come in and, all right, I'm going to come in and I'm going to do a posterior glide. So I'm pulling towards my body here. So rest your leg, okay? So I'm actually up in the groin here, and I'm going to come in and I'm going to do 1, 1, 1, 1, 1, 1, 1, 1, or 2, 2, 2, 2. So I'm pulling the femoral head in a posterior direction here, okay? And this is a really easy way to do it. Or here, I'm going to do a grade 3, so 3, 3, 3, 3, and then finally I'm going to come in and use my body weight and do 4, 4, 4, 4, 4, 4, 4, okay? And think about it, with arthrokinematics, that's going to theoretically increase hip flexion, right? Now, if my patient can't tolerate that, or if my patient is able to tolerate a different technique, what I would do, I'm going to have you get up and flip around here. Okay, so hold on one second. So what I want you to do is, I want you to, oops, pull that up. Okay, I want you to lay with your hip off the side here. So we can do what's called, here we go, the posterior hip glide. And now once again, if I needed to, yeah, you're fine right there. Okay, so bring this leg up, hold it, okay. So I want to do posterior glide, right? So if I had to use a mobilization strap, I could have that around my body. I could put it around the knee and support the leg here. But what I'm going to do is I'm going to bring her into loose pack position, right? Loose pack position would be 30 degrees of abduction, 30 degrees of external rotation, 30 degrees of hip flexion. I can come here, I can hold. I'm going to hook my hand around the greater trach. So you guys know how to find the greater trach here, okay? So I'm going to come in and I'm going to hook on the greater trach, and I'm just going to do 1, 1, 1, 1, 1, 1, 1, or 2, 2, 2, 2. Now, if I was using a mobilization strap, it would be around my, my shoulder and around her thigh, and then I really wouldn't need this hand, right? But for this, I can actually come in here, find the greater trach. Be very careful not to be on the ASIS. You're not mobilizing the pelvis, okay? We are mobilizing femur in the in the joint, okay? So we're really hooking onto that greater trach right there. So greater trach, 1, 1, 1, 1, 1, 1, 1, 2, 2, 2. And if I had to go deeper, I could go deeper in this position, okay? Very easy right here. If you need to use a strap, you can use a strap, okay? So for hip extension now, think about that, okay? I need you to go on your stomach, please. There you go. You want a bigger pillow? Here. Okay. So for hip extension, all right. All right, so hip extension, which direction are we trying to get the slide to go? So hip extension, we need the slide to go anteriorly, right? So we are going to mobilize towards the anterior part of the hip, okay? So let me turn this way. And what I'm going to do is there's a couple ways I can do this, okay? I can actually have my patient think about mobilizing the anterior hip. I can put them in a figure 4 position, so relax. Put them in figure 4 here. And then what I'm gonna do is put a pillow or a towel roll underneath the hip to give me some room here. Okay, so if you wanna lift your hips up there for me, okay? So that I'm getting them up off the table just a little, okay? Figure 4. So I can come here, now they're in a little bit of hip flexion here. I can still find the greater choke, right? I can stabilize, and I can come in, and I can go anteriorly. Yeah, just ignore him. Okay, so I can come in here, anterior. There's the greater choke right there. Once again, you're not up on the pelvis. You're not down on the femur. You are on the greater trochanter. So if you cannot find the greater trochanter, you need to go back to your trail guide and figure out where it's at, okay? If you can't find it, what you can do is palpate the side of the thigh and just rotate in and out here, okay? Very, very easy to find the greater troch, but it's not at the pelvis, it's down the thigh. And then I'm gonna come in here and I'm gonna do 1, 1, 1, 1, 1, 1, 1, 1, 1, or 2, 2, 2. And once again, guys, now I'm a little short for this, so if I was in the clinic, I probably would either lower the table or I would get a step stool for myself, okay, so that you guys know you have got to get your body in a position to be able to do this, because when we talked about this back in ortho, remember I said it's easier to lock your elbow out like this, right? You want to lock your elbow and use your body weight versus doing this, like where you're actually pushing with your arm. You guys will, you'll be exhausted and you don't get the leverage in the joint. Okay, so that's anterior. Okay, same thing now if I have a patient that can, you're going to scoot back off the table for me. I can do an anterior glide also by having her lay face forward here, right? Okay, so think about this. I could use a strap, mobilization strap, right? Can you guys see me okay here? Yeah. All right, so mobilization strap, same thing. I need to have the hip in slight external rotation, slight abduction, right? And slight flexion. So 30, 30, 30. Think about loose pack position, okay? Always, 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 when we are mobilizing, we want loose pack position if the patient can tolerate it. So if I had a strap, I would have it around the thigh, around my shoulder. But what I'm going to do here is I'm going to hold her leg here in this position, okay? Once again, this is for increasing extension and or external rotation, right? Because anterior capsule, right? I'm coming on, I'm going to find the greater troch, and I'm coming in here, and 1, 1, 1, 1, 1, 1, 1, or 2, 2, 2, 2. Just be careful, because the thing that I see that is probably most problematic is I see people wanting to have the leg up like this or out like this or crossed. You have got to have it in that loose pack position. So I've got to have her in slight flexion, slight internal or external rotation, and slight abduction. So I can find that. And this is a great way to mobilize. I mean, especially if you're doing a quick mobilization with like an athlete or something like that, And I don't tend to use the straps. You're going to find a lot of therapists in the clinic use straps a lot. From my perspective, I'm just, I'd rather do it quickly. But if you need to use a strap, you just have to use the strap and get the limb in the position that you need, you need it best, and make sure that you're looking for that loose pack position. Okay. Another option. Slide back up on the table here. Once again, this is hip. Lay on your side. Face the camera, please. So let's say you have an older patient or somebody that cannot lay on their back or on their stomach or in the positions that you stay, in the positions that we just did, okay? I have lots of options. As long as you know arthrokinetic movement and you know how to position the patient, you guys can do this, with no problem, okay? So what I'm going to do here, say my patient is bedridden and I can get them on their side, I'm going to get them here in a loose pack position as best I can, right? So slight flexion, slight abduction, slight external rotation. Now from here what I can do, is I can come in, and this is hard. It's not the best option, but if I have to, I have to. Okay, so think about it. If I'm going to mobilize forward for anterior to get more extension, I can stabilize the pelvis here. I'm coming on greater troch, and my bottom hand, this hand, is gliding forward. So 1, 1, 1, 1, 1. Sometimes what I have to do is, I have another, give me 1 second. Sometimes what I have to do, because it's not the most comfortable thing, is pad the front of the patient's pelvis here, you know what I mean? So my fingers aren't digging in. You have to be very careful with what your fingers are doing. And come here, so, and then I'm really just 1, 1, 1, 1. So this bottom hand pushing forward, mobilizing anterior capsule. Or what I can do is I can come around from the front here. I can do exactly the opposite, okay? I can hook this hand on the greater troch, and I can go backwards. So I'm mobilizing posterior capsule this way. Okay, I know that's not the best view, but if you need to do it in an alternative position, this would be the way to do it, okay? All right, so the other last hip mob, and I know we did this in ortho, so go on your back, please, ma'am, madam, okay? This is the one that we did. Think about oscillation or distraction, okay? Maybe your patient has radiculopathy, maybe they have piriformis syndrome, maybe they just have osteoarthritis in the hip and they're having a lot of pain. Remember we talked about static mobilization and oscillatory mobilization. So I just showed you the grade 1s, grades 2s from an oscillation standpoint. Remember what we talked about in ortho is that you can also do something called traction, so static. So I would take her here, right? 30, 30, 30, okay? And this is where we learn to use the mob strap. So I could theoretically cross the mob strap around her ankle and just kind of lean my body back. But what I'm gonna do is come above her medial lateral malleoli here. I don't wanna pull on her ankle. I'm gonna cross my fingers and I'm just gonna come in here and have her relax, and I'm just gonna use my body weight, okay? So think about 25 to 50% traction, so I'm just slightly pulling would be a grade 1. If I go to that first restriction and I'm tractioning, that would be a grade 2. And that's what you guys, where you guys stop, okay? If you need something more, PT comes in. Grade 3 is I'm actually leaning my body weight in and I'm really trying to gap that joint, okay? Patients love that. How long would you do this for? Well, probably 60 seconds, 90 seconds, maybe longer if the patient says, oh my gosh, my pain is gone. Yeah, keep going with that, okay? All right. Thank you. Okay, so any questions? I'm going to stop my